And joining me now from Nairobi, Kenya, is Dr Githinji Gitahi. He's the Global CEO of Amref Health Africa. Good to see you again, Doctor. Now, we just said this global COVID summit showing Africa needs 7 times what's been promised to get to that 70% vaccinated a year from now. We're talking tens of millions more doses a month than promised. What will be the impact of that almost certain shortfall?
Well, the challenge, and good to connect again with you, Michael, the challenge that we are having is that we have a supply challenge in Africa. People are looking for vaccines, people are queuing, and the challenge is that if we don't get this fast enough, then we are going to lose lives. So it's about lives that are being lost. Health workers have not had access to vaccines. People who are high risk, the elderly, people with hypertension, diabetes, are hoping they can get vaccines to save their lives. And if we do not do this early enough, then what's going to happen is that the socioeconomic impact on Africa, including on women who are suffering increased, gender-based violence, young girls who are continuing to suffer teenage pregnancy because of closures, lost economic, incomes, and all that will continue. But also the world needs to realize that until Africa is safe, no one is safe, and variants will continue to develop. And you don't know when a dangerous one develops if we keep people unvaccinated. So we don't want this to be a pandemic of Africa.
Yeah, when you and I spoke back in July, you said then the trajectory of COVID in the continent, in your words, was not looking good. I mean, has it improved at all in terms of its growth and spread, or worsened?
No, it's worsened. Africa has just gotten off its third wave, which was catastrophic. If you look at what we call the case fatality rate, meaning the number of people dying out of the number confirmed to be positive, Africa now has probably a higher case fatality than the average in the world. It still retains more than 2.5% of people confirmed positive dying, but the rest of the world is coming down because of vaccination. Europe's case fatality rate has come down 67%, Michael, because of vaccination. So the problem is that if we don't vaccinate, then people continue to die. It continues to be a big burden to the health system, which is already weak, as it were, because Africa spends the least on the health system compared to the rest of the world.
You know, when we heard Cyril Ramaphosa there talking about, obviously in rampant spread you will get variants, and we could get a worse variant, and Western nations will pay for that. When you see Western nations, though, handing out third doses and continuing to toss out vaccine doses that expire, and the moral failure that entails, how does that make Africans feel in terms of how they're viewed and being treated?
Well, this is actually, as we said last time, rich countries are speaking from two sides of their mouth. They are saying on one side, we want vaccine equity, but on the other side, they are actually practicing vaccine apartheid. The question is, if you say you really want to have vaccine equity, then you must show so by action. We have, of course, donations. Donations have been promised, but they have barely been received and given into people's arms. This is the problem. The problem is that we have promises that are not being met. And when we see rich countries starting to give third doses, I said recently, it is like actually having a queue for food, but the guys at the front of the queue are on their third plate of food, but the people at the back of the queue are still waiting for their first plate of food. It is injustice. And all we are asking is, can rich countries that have already vaccinated at least 2 doses of their population move behind the queue? Because if they move behind the queue and mechanisms like COVID vaccines, mechanisms like COVAX move ahead of the queue, then we are sure that people are going to get their first and second dose. This is really it. There's no difference between a life in Chad and a life in the US. The 2 lives are of equal value. This is really the injustice that Africa is suffering.
You are an eloquent advocate for vaccine equity, Doctor. Thank you so much, Dr Githinji Gitahi there in Nairobi. Appreciate it, sir.
Thank you, Michael. Thank you.